And Secretary Becerra, it is great to see you. Can you hear me?
I can.
Great. And I hope you and your family are well and that you're settling into your new role. The last time you were here, we spoke about the importance of a public option as finishing the work of the Affordable Care Act. And I am thrilled that the budget makes the changes we made in the American Rescue Plan to the premium tax credits, made those changes permanent. And as you know, this is an important provision in the Medicare X Choice Act, my bill with Senator Tim Kaine to create a public option. In Colorado, we've seen premium decreases as a result, anywhere from 17 to even percent, even much more than that, depending on where people live. For example, a family of four in Summit County, Colorado, are going to see average savings of $151 a month, which is a tremendous accomplishment, and that's why we should make these credits permanent to allow for continued savings from America's working families. I'm really concerned that without establishing a public option alongside these credits, there will be many Americans who won't have a quality plan offered in the area they live. Many of those are rural areas, but not only. In Colorado, there are 10 counties where there are no plans or only one plan in the individual market. This obviously reduces quality and competition and increases cost. Could you discuss your views on a public option and provide a timeline on when we can begin working in earnest together on refining our proposals?
Senator, thank you for the question. Actually, my views on the public option are fairly well known. When I was a member of the House, I was active in those issues on the public option and in my votes. Certainly, President Biden, which is perhaps a more important person to concentrate on here, has said he is very supportive of a public option as a way to help reduce the cost of coverage for all Americans. And the president has said he is very open to working with House and Senate to try to come up with a solution which could include the public option. And we look forward to working with you and other members who've been trying to formulate a good plan that could get votes. I will simply tell you that whether it's on the cost side, public option has been shown, whether it's through the Congressional Budget Office or the Office of Management and Budget, that the scorekeepers for the Congress and for the executive in producing savings. And as you mentioned, what we want to do is provide greater access. The public option is one of those opportunities that gives Americans a greater chance to get coverage at a lower cost.
I hope we will work on it. As you know, the president ran on this, and you're right. You're absolutely right. It saves the federal government money while creating universal health care through a choice that every American can have. I mean, I think this would be an extremely a successful initiative and a popular one with the American people, especially after the pandemic. So anything we can do to help with that, I hope you'll let me know. Let me, in the last couple minutes I have, turn to another part of your budget. The budget includes $400 billion in funding for home and community-based care through the American Jobs Plan, which will transform the way that we care for individuals in their homes and communities. This funding through Medicaid will take care of the most vulnerable Americans, especially children and youth, and this type of care was absolutely critical in Colorado over the course of the pandemic. I'm concerned with the increased rates of mental health illness that young people are experiencing, leading to death by suicide, substance abuse, or other mental and behavioral health challenges. How should we use this funding to help address these mental health challenges, and how can mental health be integrated in home and community-based services for children receiving these services?
Senator, I know that there are a lot of folks back home in Colorado and my state of California and throughout the country who would chime in and tell us what's worked, the best practices. But what I will tell you is this. The closer we get to someone's home, their family, in providing that service, the more likely we'll see success. The more you farm out people to these institutional settings, I think the less caring it seems and less loving the care that would be provided. So I think the home and community-based setting is crucial and to the degree that we have innovative programs that are out there that we can help support, I think that's what we'll try to do at SAMHSA. Working with you and folks that you know back in your home state, I think we'll try to do the best we can in not just in Colorado but throughout the country. But really, it's pretty straightforward, not rocket science. Try to provide the treatment that people need as quickly as you can, hopefully to prevent things from getting worse. Try to do it as dear to someone who's dear to that person as possible, to make it a loving setting. And then try to make sure that you're implementing some of the innovation that's out there, providing resources to those who've shown a different way that's working well for others.
The time of the gentleman has expired. The very patient Bob Casey.